Hello, everyone, and welcome again to the HIV and Adolescence Month. We hope you really are enjoying every single session. This is session 7, and we really hope that you've been able to engage in all the other 6 sessions. They have been extraordinary, interactive, lots of fun, and also full of information. And again, kudos to the organizing committee, the scientific committee, and of course, eVirology for putting this together, even in this virtual space. But I really want to thank the Youth Reference Group. This is the core part of our scientific committee. Without the Youth Reference Group, we wouldn't know what really were the issues and how to address them best. And that's what today's session is all about. Nothing about us without us. And we have a superb lineup of people who will be bringing that message home in very real and tangible ways. So stay tuned because we're going to have a first session which involves a keynote speaker who's just an expert, then moving in the second part into some wonderful oral abstracts and lots of time for question and answer. Terrific videos coming to you from all parts of the region, and just more and more for you to learn and engage on. But without a single moment's notice, this is what it's all about. I want to introduce my fantastic co-chairs this afternoon. They too have contributed to the scientific program into how we should run the eVirology workshop this year. And so without a moment's notice, I want to welcome Zoe Nakamba and Lazarus Ndlenga, who come to us. And I'm going to ask each of them to introduce themselves, tell you how they got into the work they do in just a few short sentences. So over to you, Zoe.
My name is Kanengo Zoe Nakamba, and I'm Deputy Director for the Zambia Network of Young People Living with HIV. I'm a health activist, a medical student, a junior researcher, and a neurosurgery apprentice. Thank you, Linda.
And what about you, Lazarus?
Hi, everyone. My name is Lazarus Ndlenga. I'm a senior Nambian adolescent treatment supporter. Most of you guys call it CATS in your regions. Well, I'm also a vice president under a movement of young people in Namibia called the Youth Empowerment Group. And yeah, I'm very excited for this section, actually.
Great. And so without further ado, I'm going to hand over to our keynote speaker for this afternoon. And it's my great pleasure to introduce to you Abigail Solomon. So Abigail comes to us from Namibia, where she runs the Positive Vibes Trust. Abigail Solomon's passion for discourse analysis, working with groups most marginalized, and exploring the drivers of intercultural miscommunication has enabled her to delve into human rights responses that aim to address the root causes of othering of sexual and gender minorities in Namibia. So I think just really highly expert to give us her talk, and it's my pleasure to hand over to you, Abigail, to present the keynote address.
Hi everyone, I'm Abigail Solomon from Positive Vibes Trust based in Windhoek, Namibia. I am deeply honored to be part of the international workshop on HIV and adolescence, especially this conversation around active youth participation in research. What does this look like? What does this mean? Why is this important? Positive Vibes Trust is an organization that works primarily in Africa to end othering, the othering of marginalized, vulnerable, and often criminalized groups, including adolescent girls and young women, LGBT persons, sex workers, and other marginalized communities. Our work is centered around core beliefs. One of these beliefs is that human beings have inherent dignity and worth. That informs our second belief, that is that people, especially those that experience chronic, acute exclusion and marginalization, must be the subject of their own response, not simply the objects and targets of interventions by others. Thirdly, that rights and health are indivisible. when rights, including the right to participation, are sidelined, even with the best of intentions, health outcomes suffer. This requires authentic participation, the recognition, the acknowledgement of disparities in power, the access to information, choice, decision-making, and negotiation to resolve these imbalances that perpetuate inequity and reduce dignity. A core belief that is especially important for this conversation is community-led research and monitoring that informs accountability. These are strategies to mitigate civic, social, political, economic, and structural inequality and injustice, increase individual confidence and agency, and amplify voice and dignity. We live in a world where we are increasingly prompted for feedback, to make assessments and offer judgments about all kinds of subject matter, both profound and mundane. Trucks on highways display bumper stickers asking, "How's my driving?" Restaurant managers pass by our tables, "How's your meal?" Conference and workshop organizers distribute evaluation forms at the end of most meetings to ask, "Have we done a good job?" In our modern age, most industries have realized an important truth: feedback matters. So when we look at health services, if healthcare were a product, a commodity, surely consumers might expect to have some say in the quality of the product. However, we have created an unhelpful and artificial distinction between the health system, populated by technicians and clinicians and professionals who provide these services, and then community systems populated by individuals, households, families, neighbors who interact socially and relationally to support and promote healthy behaviors. This includes our youth. Perhaps citizens and communities have come to see themselves only as receivers of services supplied by public health providers, rather than the stakeholders whose participation in an integrated system for health is required to ensure that services are effective and both relevant and responsive to the lived experience of people in community, especially our youth. As recently as the World AIDS Conference in July 2020, leading global institutions, including the International AIDS Society, PEPFAR, the Global Fund, and UNAIDS, have affirmed the role of communities in strengthening health systems and programs, the growing emphasis on social determinants of health and health-promoting behavior, and the emergent priority of community-led monitoring of health facilities and services. This is an important signal of future policy, practice, and priority across countries around the world. But what does youth-led research look like? It means that research needs, questions, priorities are defined by youth. That youth takes part in the development of protocol and inform the development of methodologies. That youth take part in the implementation of the research activity either through community mobilization, data collection, and analysis. That community members, including youth, lead the monitoring of progress, including the tracking of application of ethical procedures, either through the establishment of a community research board and frequently engaging with community members. That youth verifies and validates data, and that youth leads in the dissemination of data and packaging of data to best serve the application of findings and lessons learned. But why is youth-led participation so important? We are more than numbers or targets. To ensure that no harm is done, youth wants and need to be respected in their personhood. Participatory research allows youth to understand, inform, and actively participate in research activities. By engaging from the onset with the relevant stakeholders, we ensure that the youth are no longer objects of research, but active players. They understand why the research is important, why it's being done. Their expertise informs the development of protocol and tools. More importantly, they understand what findings will be used for and how lessons learned will be applied. Youth-led ownership and leadership in research is especially important to create trust within community. Only when leading, when involved and consulted, will youth share deeply personal stories, stories that often provide us with clues to underlying factors impeding equitable healthcare. The story below was shared during one of our community interventions and led by community youth activists that looks at the struggles that young women face in this particular region. So elongation of the labia minora. When I was 8 years old, I was instructed by my grandmother to start to pull and stretch my labia. I did not know that this was to provide for the sexual pleasure of my future husband. I was just told I would not get a husband if I don't have a long labia. Girls' genitals are regularly inspected to see whether they are pulling their labia correctly, and girls are evaluated by the length of their labia. Before a wedding night, a woman may be inspected, and if she does not have a long labia, she may be sent back to her grandmother for further training. This deeply personal story would not have been shared with a stranger, with an outsider. And for many of our processes, we need to establish trust within our communities. The only way to establish trust is when people within the community lead on these processes and understand why these processes are taking place. A very important consideration is to ensure that data is representative of diversity within youth-focused studies. Unless the purpose of the study is specifically designed to explore the vulnerabilities, needs, and context of subcommunities, many studies revert to heteronormative, cisgender assumptions relating to youth demographics. For example, LBQ women and trans men data is often subsumed within data sets that make heteronormative assumption what constitutes womanhood, assumptions on the types of sex women have, the types of reproductive and sexual needs women have, the types of relationships engaged in, which in turn influence the types of questions we ask. These assumptions, the findings, the lessons learned, then translate into policy and practice. To ensure that youth-related health policy, law, and practice is nuanced, youth participation, diverse youth participation, is key. Country and regional policy, unless specifically designed to cater for specific subpopulations, are often heteronormative and assumes a homogeneity amongst youth groups. Policies and strategies that integrate, for instance, gender considerations almost always assumes girls and young women, boys and young men who are cisgender and heterosexual. Sexual and gender diversity is not considered. This lack of acknowledgement fuels then the never-ending cycle of limited national budgeting for diverse youth, lack of focused and nuanced interventions, procurement of SRH and related commodities, and the development of specific nuanced communication materials. Youth participation, diverse youth participation, ownership and leadership within research ensures equitable youth-focused health solutions. Health services to youth requires these equitable solutions so that they are fair, accessible, appropriate to and adjusting for, compensating for and making provision for diversity so that no one is included from good health because of their diversity. Equity requires that youth are treated in attitude and regard and literally in medical treatment, as if each person is equally deserving of the highest standard of health, suited to their unique needs and right fit for gender and for sexual orientation, and within the easy reach of young people who often face many barriers, social, economic, class, physical, legal, and environmental, to accessing services. I'd like to end this address with words from Namibian Ombudsman, Advocate John Walters, who said, "The opposite of exclusion is not inclusion, it's justice." Youth-led participation in research is essential to ensure appropriate, nuanced, and owned research design and process. Youth ownership and leadership in research leads to the application of lessons to strengthen youth-focused policy, law, and practice. We look forward to the continuing of this conversation with other presentations, and with these words, I thank you.
Wow. I would like to thank Miss Abigail. Thank you for that wonderful speech. And I could not agree more. The only key to forward, I think, it's to involve is the participation of adolescents in research and young people, because their voice matters. And with that said, I would like to introduce a video that I conducted. it's actually an interview video that I engage young people on research to find out how do we engage meaningfully young people, youth, adolescent in research, and to find out the challenges that are faced by young researchers that we face on a daily basis. I did this video because I believe that there's nothing more interesting than young people's voices themselves, because our voice matters in everything, whether it's research. And I feel like research is mostly the key, because we have to engage these young people. Let's look at the video now.
From Namibia. My name is Stephen Bernardes Tcharaktaip. I'm the BFRE coordinator at the Office of the First Lady, head of programs, as well as the technical director for the One Economy Foundation. One of the key things that we're excited about with young people in engaging in research is really understanding evidence. So research allows us to be able to go into that place and measure the evidence and use that evidence to inform policy. We have to have young people's voices in the conversation so that they are able to articulate their concerns, articulate the needs that they are having, so that they can be able to start to change the discourse and the narrative. And the key issues around engaging around young people in the research space is really to allow for new voices, emerging voices, and sometimes dissenting voices around ideas to be able to solidify our ask, and at the same time think about how we can change our positioning and even elevate the quality of our conversation. Without the data informing us, what we're pretty much doing is doing programming in the dark. We're doing programming from observation and doing programming that doesn't really speak to necessarily the lived experiences. Evidence and research helps young people to articulate and frame the challenges that they are facing in a way that is able to translate beyond just the group and the people that they speak to, but to policymakers, programmers beyond in the world as well. So we encourage every young person to become an active researcher. We encourage organizations and policymakers to support research, research that also happens on a community level, through organizations such as the Teen Club, where young people can be observed, and those observations can be generating evidence that can help and strengthen our policy response and our program response. Thank you.
Hi, my name is Helena Ngaifiwa. I'm the project officer from the One Economy Foundation.
What are the challenges that young researchers face?
Okay. One of the biggest challenges that young people face, not only in Namibia, but of course in Africa, is access to information. This in all, we tap into data. Young people we don't have data. We don't have Wi-Fi. There's no finance. There's no young person, and this is definitely, especially in the grassroots areas, which is the larger places, or where the larger area where so many young people live. There's no Wi-Fi, and we saw this reality hit when we went into COVID lockdown, where our young people were forced to study online. And this, for me, there was a little bit of a, I don't know if it's with our governments, or of course with the leadership in place, because our young people don't have access to data. And that comes back to just finance, because we don't have the finance or the necessary measures in place to make sure that these services are available to young people.
Good afternoon. My name is Twilika Elias, a clinical psychology graduate, but I'm also very much as a person passionate about the work of HIV, as well as GBV and sexual and gender-based violence. These are the issues that affect young people in our society on a daily basis. Yes. If they can engage with institutions that does research, and they can, as a way to try and see how does these institutions work, how are their working environments, and at the same time they can come up with ideas and say, okay, I have noticed that this is how your institution works. Perhaps as a young person and as a researcher, I feel and believe that if your environment is like this and it's not favorable for a young researcher, can we look into this idea of making the environment inclusive of young people from all walks of life, and at the same time also just give internships to young people, and let the environment be a safe space and non-judgmental space where researchers can feel free, and at the same time learn in an environment that allows to carry out research in a safe space. So yes, young people, what I have noticed is that young people are very inquisitive, meaning that they like to have facts that are research based, and I feel for that they are willing to go an extra mile to do research to find out why perhaps this policy was implemented. They would love to find out why things are done this way. And I think that when it comes to research, not everyone is keen on taking on the research process, but I believe that is young people that are very much interested in research and would like to take part in research and do research as well. Yes.
Well, hi again, everyone. I think you will agree that that was an extraordinary set of information for us. So well done, Lazarus. Great, great video. And my hearty thanks to Abigail. I think you really hit the very important high points in terms of why this is so important. And I'm really pleased that together with Zoe and Lazarus, and I think Zoe's just run into some electricity trouble, but it's nice to have you back, Zoe. I hope everything's okay. We will be fielding questions, so reminding everyone to put your questions into the Q&A, because that's where we're going to be able to view them, to be able to ask questions and keep them going. But maybe I can start with my first question, and then Lazarus and Zoe, if you can line up yours as well. To Abigail, first of all, just to ask clearly, the charges to involve adolescents at large, increasingly in the work we do, in the research we do. But you took us that one step further, which is young people who are in the so-called key population group. What do you think, what's the additional effort that needs to go into doing that? I mean, what do you think listeners who are wanting to see more involvement of adolescents, what they need to take into consideration when they're thinking about people from the so-called key population groups? And I want to just say my definition of key populations is those people who have an even higher burden of HIV, but actually have the least access to good services. So over to you, Abigail.
Hi, Linda Gale, and thank you for the question. I think we're living in a time, especially coming from the region that I come from, where we are experiencing so much backlash and just pushback from naysayers. Naysayers in terms of the realization of sexual and reproductive health for all, and specifically for very young LGBT communities. And I would like to include maybe some of the sex worker conversations as well, because we know we're living in an environment where it's difficult to talk about these things. It is, in an African context, we don't talk about sex anyway, let alone sex talking about sex with our children, talking about sex between same-sex relationships. So I think a step further is actually engaging with the current commitments, and I know for Namibia this is a hot topic, on comprehensive sexuality education, because that is where research starts. That is where our teachers who actually have direct access and could shape this enabling environment for development for youth that generally go through such difficult times and exploring of self, with the added considerations like I could be gay, I like this boy and I'm a boy and my people do not want to talk about this, that we start engaging in these conversations as well, because that is the environment where information is shared, that is the environment where the safe space is established for children to engage in conversations. But we have to consider, especially for this particular group, that there is a lot of dropout, and how to make that group within our, especially with civil society that has far reaches within communities. How do we ensure that we have ethical approaches when we start engaging with very marginalized, very vulnerable youth on topics related to sexuality, on topics related to gender, especially in environments that criminalize such. So it is definitely the engagement CSE, but definitely starting exploring and pushing for legal reform. If you criminalize in a space, you just provide additional backing to the naysayer.
Yeah, and I guess what I was really sort of reaching for, and I think you've alluded to it, is that it isn't always safe for these young people to, you know, to either out themselves or to out their networks, and just to maybe give that cautionary note that we also don't want to do harm, and so it's always important.
Definitely.
Somebody has already raised, and it was within, you know, the expected 40 seconds, what are the ethical concerns? So do you want to, I mean, that is a topic that could take us all afternoon, but do you want to just raise at least a few of the sort of ethical issues that need to be considered?
What level of study, and we don't want to create an environment that outs students within spaces, that outs students within their communities. So definitely looking at age, looking at who is best placed to also then provide psychosocial support if you go through these research processes, and not just conduct research for the purposes of generating evidence, but also providing the safe space in which you can have these conversations with you. So I think a lot of the conversations is around age, it's around appropriate questions, it's around who is in that situation, and consistently engaging with whatever community advisory board that you have in that space to protect this young child.
Yeah, and I mean, I'll ask Zoe and Lazarus to comment about this as well. How, you know, how do we balance the requirements of funders for research, where you know, obviously the focus of involving adolescents may not be high on their agenda? Do you want to sort of anyone tackle that who might have some thoughts on that?
Okay, I think how do we balance the requirements? I think I feel like we should really, like, as young people, since we are not given a lot of opportunity to sit at the high table, we should already, as the lady Twilika from the video said, we should already do our own research when we are given that opportunity. And we have already our data, and then we say this is what we have. I think that is what can work for us to balance the requirements from my side.
Great. Lazarus and Zoe, do you have
Yeah.
any questions while we're waiting for more questions?
I just wanted to comment on that, Linda.
Sure. Thanks, Zoe.
Yeah, I think that if funders would like to implement or put their money where, you know, interventions are working, then to have young people participate in research or be engaged in research is important. Otherwise, for young people, what works is doing the work with young people if you want to win with young people. Otherwise, they'll be putting money where, you know, in programs that don't work. So I think for me, research for young people should be top priority, because we see that infections are highest there. And so if infections are highest there, our focus should be in engaging these young people to find solutions, what works best for young people.
I couldn't agree more, Zoe. I think that what you're saying is the investment case needs to be made. And I think until we teach funders that they're going to continue to get, you know, non-impactful research outcomes unless they invest in adolescent and young people input at the beginning. You know, it's about the investment, right, up front. So I think we have to tell that narrative a little bit better than what we have been doing. I couldn't agree more. Abigail, there's another question around, can you sort of cite any examples where, you know, particularly YKP have been involved in meaningfully in a program or a research project right throughout the life cycle of the project. And whether it's actually increased recruitment and actually paid off in terms of a better outcome by so doing. In other words, involving and incorporating youth-led research.
So Namibia is interesting in terms of our even engagement with, I'm going to say LGBT specifically. So we did some specific activities around male couples, male-male couples, same-sex couples, and it was a fairly young demographic. From the onset, they defined what a relationship looks like. They defined who do we need to engage with. They defined who needs to be part of the community advisory board. What questions do we ask? So we did some cognitive assessments of the actual tools. Do you understand the language that we're using in these tools? Do you understand the specific questions and why we're asking these questions? How are we interpreting these questions? So that we could apply it in Namibia, we could apply it in KwaZulu-Natal, for instance. And one of the things, because we included a diverse range of young people in this particular study, we had voices of trans community come up saying, specifically trans women, saying, we're not part of this MSM male-male couple definition. We need to specifically have specific processes that engage with us. So a lot of their focus groups were then immediately transferred into poems, and we did a poetic inquiry of their conversations because they informed the process. So that was very interesting in terms of how youth was, and the particular groups that we want to engage with, they informed the process, they informed the design, they informed safety, ethics, who do you need to talk to? You can't just do a couples test, the HIV couples test, there's SGBV could be ignited. We do not have the protection within our communities. You need to schedule it in this way. So questions we do not always have answers to, they were able to inform. So that is one of the concrete examples I can definitely make.
Thanks. Zoe, I think you have a question for Abigail.
Key populations. Here in Zambia, it's very difficult to engage them. How have you been able to handle the security concerns and just meet these young people, especially the youngest ones? I think it's very difficult for you to even invite them to a meeting, for example. So how are you managing to engage these young people to ensure that data is there that involves an accurate data? Because I think what we see is that because they're not open enough to share their story, in countries like mine where, you know, it's criminalized, you see that people have false data and they can't still come out also to say, how can we that are faced with such challenges overcome them?
Yeah, that is one of, because Namibia, we criminalize same-sex behavior. We have a sodomy offense. It's not actively pursued, but it does create this perception in community that all LGBT are criminalized. And I think it's the same in your context as well. One of the things we need to do is go to where they are comfortable, go to where they are at. If it is in their home space, that is where we take the research. It's not having them exposed within spaces, because organizations are known. They, like Positive Vibes is known. We work with LGBT, we work with sex workers, we work with adolescent girls and young women. We're known and our faces are known. So coming to our space out. So it is always vital to go to where people are comfortable and have advisory boards, like tell you where people are comfortable. And I think an important second consideration is, and it's around this trust, the conversation around trust. If you're not trusted within your community, that you'll actually use the data to serve a purpose, to engage with policymakers, to engage with academia, to engage with school systems, with community systems, you lose the trust of community. Communities want to share and they want to have their voices heard. But if they don't see any results from those conversations, even if it is to give pushback to the decrim conversation, they lose trust. They lose trust in the research activities. It's really ensuring that we use the data. They know why we're using data, why we're asking the questions.
Okay, thank you for that brilliant answer. I'd like to remind everybody that is participating in the workshop, leave your comments in the comment box. And Abigail, I have another question. So Alice is asking, how do we get funders more interested in allocating funds to ensuring youth engagement in research design?
I think this is with strategic fundraising. We often, and I'm going to talk from civil society perspective, we go into a space where we're responsive to calls and we're not responsive to the actual strategic design of what we want to do. And we need to start to do strategic fundraising. We need to go to the donors, we need to go to the funding agencies that support our initiatives, start generating evidence that speaks to this particular crowd, building that evidence pool, because that also influences other funders. Community-led monitoring is one of these examples. It was not something we were talking about, I think, even a year back in Namibia. But because a lot of civil society, a lot of the human rights activists, a lot of the communities have started engaging, and we need to have participatory-led processes that is rooted within community. A lot of the funding agencies are language is standardized across this global environment. And it's not that big. This global pool is not that big. People know people. People are working together and strategizing and looking at who's funding which stream. So it is really ensuring that we just standardize this language across the board.
Great. I think just before the break, Lazarus has a question for you, Abigail.
I want just to know, because Namibia, there's a lot of cultural belief, and how really do you bypass them to go collect? You make sure that you have the data, because I have come across a lot of cultural beliefs, and you find out like someone doesn't want to participate, and then Zoe also emphasized on the issue of consent, and that is one challenge, a big challenge, a huge challenge when it comes to a underage adolescent, where you need the permission of an adult to get the information extract, and without consent you cannot really do much, and you really need that data. So how do you just make sure that you get that data?
I think that is especially, Lazarus, us working in the north, in northern Namibia, where culture is still so strong. It is definitely working with those traditional leaders. It's working with religious leaders. It's working with the regional management teams. It's working with these local influencers in communities so that they understand why data is being collected. People often don't understand. We're going to spaces, there's a new face every second week. We want to collect data on this, we want to collect data on that. But we don't engage with the communities around why we are collecting any level of data and what it's going to be used for. When we understand what data is and why data is necessary, I think there's a lot more buy-in from our leadership. And it's across all sites where you need to engage with the local persons. You need to have them on board. That's always the struggle.
Thank you, Abigail. Thank you, Abigail, for that brilliant answer. We'll go straight into our break. So we're taking a 5 minutes break. And when we return, we have amazing oral abstracts. And if you're a young researcher or watching us, please tune back. So we're taking 5 minutes.
But I think I walk it with you. Some people say cuties are messed up, but I think you're such a sweetheart. Everybody think I am crazy, but I know I'm just in love with you.
Welcome back, everyone. It's lovely to have you back again. This is session 7 of the HIV and Adolescence workshop month. And again, we're delighted to have you all participating. So for this part of the workshop, we will be presenting some oral abstracts. So reminding everyone, these were peer-reviewed. They were selected by the organizing scientific committee and the youth reference group. And so they've been competitively chosen. And so congratulations to everyone who's been able to present oral abstracts throughout the month. At the end of today's sessions, we'll have a full panel question and answer so that we can hear the voices of everyone. That means we need you to put your questions in the Q&A section now so that we have those questions lined up. So without further ado, though, I am very pleased to say that Zoe, who unfortunately has left us just for the moment and hopefully will be back soon, videoed a colleague who I think let him speak for himself, but he makes a compelling plea to involve adolescents more in research and for young people to become researchers. So have a listen to this video.
Hello, I'm Dr. Pena Stembo and I'm a research fellow with the Young Emerging Scientists Zambia. And I want to address how junior researchers can develop research work. And I feel the first step in developing research work is by aligning ourselves within the various spheres of research. Where do our research interests lie as young people? Are we interested in non-communicable diseases? Are we interested in infectious diseases? Are we interested in sexual and reproductive health? So where our interest lies is where we should focus on. And once we do that, we need to find mentors within those spheres that actually inspire us to be researchers. By doing that, we'll be taking the first step in developing research work. And then we need to actually put in the work. We need to actually be actively engaged in the projects that these researchers are actually doing. By doing that, again, we will actually learn from them and grow our research potential. And indeed, on the part of these organizations that actually can take young people on board, they need to take more and more young people on board. More research hubs need to find spaces for young people to be on their projects, not only in advocacy, but indeed in research as well. Thank you.
Hey guys, I hope you guys had a wonderful break. In my country, they say future is queen. So I'm happy to introduce our first abstract presenter on adolescent girl-led participatory action research. She goes by the name of Miss Chelsea Hockley from grassroots South Africa, South Africa. So, and please do remember to put your question in the Q&A box. Thank you.
Thank you for the introduction. Today I'm going to talk about an adolescent girl-led participatory action research project and share lessons from a sport-based cluster randomized trial in Cape Town, South Africa. There is extensive evidence that adolescent girls and young women are particularly at risk for HIV, STIs, and unintended pregnancy. There's also evidence that spending additional years in secondary school is protective and reduces the risk of HIV infection. There's also evidence that comprehensive sexuality programs that address gender and power are 5 times more likely to achieve SRH outcomes. However, integration of CSE programs at school is suboptimal and delivery mechanisms need to be optimized. Therefore, our study explored 2 different platforms. One was classroom-based, in-school and teacher-led, and the other added a supplementary component after school, which was led by a near-peer facilitator. It was interactive and sport-based. Our study design was a cluster randomized trial in 40 secondary schools, engaging female learners aged 14 to 17. We had 3 study objectives. The first looked at the impact of the integrated program on HIV, chlamydia, gonorrhea, and pregnancy. The second looked at the impact on school absenteeism. And the third evaluated the acceptability and the feasibility of the integrated program. The third objective we'll focus on today. We used a number of traditional and non-traditional qualitative study methods to evaluate acceptability and feasibility. These study methods included multiple stakeholders in the program. Today, we'll focus on the adolescent participants and on participatory workshops that were led by their peers. These workshops included focus group discussions, a dream program activity, peer interviews, and activities to assess girls' interest in different SRH topics. So what are YPAR methods? YPAR is Youth-Led Participatory Action Research, and it's an innovative approach to positive youth development, which trains adolescents to take on an active role in research. And it's important because it disrupts the typical power dynamic that exists between a researcher and a subject. And it's also important because it emphasizes youth-adult power sharing. We use these methods to complement our traditional methods, and we aimed to elicit more authentic data and channel youth voices in the creation of recommendations and solutions and to inform future programs and research. We also wanted to recognize the important expert role that adolescents can play in research and programming. Our YPAR project followed 6 steps. The first was selecting youth investigators. The second was training youth investigators. The third was co-developing and testing tools. The fourth was youth-led data collection. The fifth step was debriefing and collaborative coding. And the sixth was to summarize key findings for dissemination. In a little bit more detail, the first phase was selecting the youth investigators. Teachers from intervention and control schools selected 2 to 3 investigators from each school, and they were guided by a few criteria: engagement in the program, good communication and leadership skills, curiosity, and an interest in building further skills. The second step was training the YIs. There were basic research skills that were covered, such as research ethics, facilitation skills, identifying key themes, and also taking process notes to document the process of being a youth investigator. The YIs also refined important research questions, such as what factors influenced whether girls in the program got pregnant or an STI, how girls felt about the program, and what really important aspects they would recommend for future SRH programs. The third phase was co-development and testing of tools. The YIs worked on data collection tools and then they tested them on each other. This process resulted in some very important changes to the methods. The fourth stage was youth-led data collection. After the YIs were trained, they conducted workshops in pairs and they were supported by research assistants who were graduate students. These workshops included focus group discussions where they explored aspects of the program, relationships, friendships. They also created a collage about what their dream program would look like for girls. They conducted interviews with their peers, and they conducted a topic sorting activity where they prioritized sexual health topics, and they completed time wheels. The fifth phase was group debrief and collaborative coding. The participants did 2 workshops where they debriefed on the data collection process, and they collaboratively analyzed the data where they read through transcripts and also looked at images from the collages. They discussed what they felt were the most meaningful excerpts, and they constructed themes around the transcriptions. And then the last phase was summarizing findings for dissemination. They summarized their findings by stakeholder, so who they would like to share this information with, peers, teachers, principals, and they talked about what the most important findings were, what it meant to be a YI, and what they learned. Some of the important themes from their findings were that peer pressure was a dominant theme, influencing girls' perceptions of healthy and unhealthy relationships, and the importance of schooling. For example, one of them said, first, you must focus on your books because boys bring babies. Secondly, there was a strong desire for comprehensive sexuality education in school-based health services, so the program was very acceptable. However, they saw teachers' fears of having direct conversations about sexuality as a barrier to effective and open communication. And finally, they shared lots of creative ideas to inform the design of future programs. Adult study analysts also looked at the data and found similar findings. The program was highly acceptable. In addition, they found that participants valued the safe space that mentors created in the program, and that girls talked about being very uncomfortable in the teacher-led program. And they felt that some crucial information was being concealed, especially around consent and negotiating safer sex. Finally, our lessons and next steps. Inviting adolescents to participate actively in the data collection process was feasible. Our youth investigators mostly participated in the full process, including training, collection, and summary for dissemination. And they also found that the training and methods were acceptable. They described the process as empowering. However, we recommend taking more time to conduct training. Qualitative methods do require probing, and this was something that the YIs were not very comfortable with. And we also recommend including YIs from inception to really refine research questions at length. Our next steps are to integrate YPAR data with other study data and to engage YIs meaningfully in the dissemination process. So our recommendations are to employ non-traditional methods as they do elicit more authentic data. And we think these are feasible and acceptable approaches to take, and that they generate rich, actionable data for adolescent-informed solutions. Thank you. I'd like to acknowledge all of the investigators and all of the participants, as well as our funders.
Well, viva youth participation, viva. Well done. Terrific, Chelsea. I think answering some of the questions of what are some of the programs that have actually involved youth investigators from beginning to end. And I'm sure there'll be time to probe a little bit more at the end of this session when we'll bring the panel together. But I'm delighted now to move to our second oral abstract. This is my good friend, Dr. Clarence Yar. And he's looking at the use of an SMS messaging platform during COVID-19 to share safety tips and know participants' well-being. So this is Dr. Clarence Yar, and we hand over to him. He's at the WITS RHI in Joburg. Clarence.
Good afternoon, everybody. My name is Dr. Clarence. I need HIV and Adolescent Workshop and Virology Education 2020. And on behalf of other colleagues, I'll be talking on the use of an SMS messaging platform in COVID-19 pandemic to know participant well-being, the gap year cluster, and my trial experiences. So in terms of the background, we know that the emergence of the COVID-19 pandemic has created unprecedented stress among adolescents, where face masks is becoming a compulsory dressing attitude to reduce COVID-19 spread, social distancing and lockdown of social amenities to reduce gathering and spread of COVID-19, and in some circumstances, sporting events are even held without spectators. And also the increasing death and infection in our community has caused confusion, depression, and uncertainty among the future of adolescents and increasing orphanhood. In terms of the method, in terms of the study objectives, we know that there is lack of data on maintaining communication with adolescents, their parents, and study participants more broadly during a global pandemic. So we sought to get a snapshot and describe the views of adolescents and their parents' well-being who were part of an ongoing trial during the COVID-19 pandemic in South Africa. So in terms of the method, we should know that the gap year study is for at empowering adolescent girls' health, positive gender attitudes among adolescent boys as they progress in education. So this study was conducted in 2 provinces, 3 townships, and in 26 schools in South Africa. So just by default, during the enrollment of the gap year participant, we collected phone numbers of the parents of the learners and created an open access SMS free platform and interaction with adolescent parents with regards to the progress of the study. So in terms of the SMS delivery approach and method, so during the COVID-19 pandemic lockdown, the gap year decided to use the SMS platform from March to July 2020, which was actually the peak of the epidemics, to leverage and share materials, information on COVID-19, including and not limited to COVID-19 prevention. We had information on gender-based violence, food security, helplines, safety helplines, mental and health services, community-based organization providing services to adolescents in our communities. So the data was then generated and coded and grouped into teams. But I would like to emphasize here that we should note that the resending of the SMSs to parents' phones was based on the replies and urgent need and the responses gathered from the previous responses. So in terms of the results, we sent out closely 10,000 SMSs, which translates to 9 SMSs per parent. And we had a good number, that's 95% delivered to parent phones. And we had 102 responses And we should note here that the SMSs were used as push messages. Therefore, responses were not required as a measure of success in this study. So some of the emerging themes that being, we are very healthy and safe as a family. In terms of food security, we are fine, but my parents cannot afford the food because we must eat and day and night. In terms of feeling of anxiety, I'm scared to send my children to school because of the coronavirus. So in conclusion, we can say that an SMS platform is an alternative good reason. Reaching study participants early and often during a pandemic, sharing resources where restriction and lockdown are imposed, knowing participant well-being, promotion and awareness of services such as gender-based violence, COVID-19, security helpline numbers, mental health and safety advice, relief organization in the community. However, we should note here that this method relies on responses to guide the content of future messages and strong linkages to resources. Therefore, further research is required to retrospectively assess family experiences. I would like to thank the reproductive health, especially the PI of this study, Professor Molek, and also the co-PI, Nicolette Naidu, the Gabia study team, the parents and the learners, and then the founder, Bill and Melinda Gates Foundation. If you need further information, please you can contact me on the email as indicated below. Thanks.
Very great presentations there. The use of text messages to remind our peers, and yeah, very effective. And now I'm happy to introduce our next presenter, Harry Edwards from Desmond Tutu Foundation, Health Foundation in South Africa. So at the beginning, I said when I introduced Miss Chelsea, I said the female. They say the female is the future is queen, but I think the future is equity. So let's hear from our next presenter.
Hello, my name is Harley Edwards, and I want to be talking about capacity building to enhance adolescence in research. It could be said that adolescents are often forgotten in research due to many factors such as ethical legal challenges. It can be difficult to consent them depending on their age. They are often a difficult to reach and vulnerable population. There are time constraints when it comes to accessing them. They're often in education or training. They are going through a developmental stage of many physiological changes, and socializing and peers are usually a priority, and research is not even on their radar. This can lead to a lack of understanding of research implications on their part. All of this adds up to an insufficient body of research and a lack of evidence-based policy and programming, as well as clinical-based interventions that focus specifically on adolescents. The Desmond Tutu Health Foundation Center of Excellence has a mandate that ensures an adolescent research focus with specific aims to include adolescents in the research process to result in improved programming and policy. The Adolescent Health Division within DTHF is a research group committed to supporting adolescent access to and uptake of sexual healthcare services during this fundamental habit-forming period of life. DTHF's support of adolescent research includes adding to the body of information and building interest in the field through multiple approaches to respond to questions such as, where are the people who want to become adolescent researchers? And how can we build their interest, excitement, passion, and skills? DTHF takes multiple approaches in response to such questions, including an online e-fellowship, making tools and templates and information widely available through an online toolkit, as well as ensuring policy stakeholders keep up to date with policies through a short course. DTHF is also working hard on participatory processes to encourage adolescents themselves to become skilled researchers. The Adolescent and Youth Health Policy short course, hosted by DTHF at the University of Cape Town's Health Science faculty, is aimed at building the capacity of government and NGO officials involved in the implementation of adolescent healthcare programs on a national, provincial, and district level. The course is an adaptation of the course on adolescent health in low and middle income countries run by the London School of Hygiene and Tropical Medicine and the World Health Organization, and this is made possible by Vive Healthcare. A similar course has been adapted and run in India, Nigeria, and Ghana. In an effort to prioritize the health needs of adolescents, the South African government developed the Adolescent and Youth Health Policy in 2017, and it contains strategies to overcome key problems experienced by adolescents and youth aged 10 to 24, and it purposely empowered and involved them in the policy development. A gap was identified in staff implementing and supporting adolescent programs at various levels, and this resulted in the short course first being conducted in 2017 to meet this need. The course originally involved a 5-day full-time taught portion exposing participants to experts from a variety of governmental and NGO sectors, but due to the COVID pandemic, the 2020 iteration was rapidly shifted to online platforms. The course has included and aims to expand its reach to participants from neighboring countries with the idea to further adapt and expand the course to other parts of sub-Saharan Africa to continue to support adolescent program managers and their staff. And here, for example, you can see some of the topics that are covered. ETHF established the International AIDS Vaccine Initiative Fellowship and the Adolescents in Research Toolkit together with IAVI and AHISA respectively. Here you can see a brief overview of the structure of the fellowship, which is really centered on the mentorship aspect. The fellowship was originally an in-person program, and it provided fellows with an opportunity to gain field experience in the area of clinical research. In order to expand reach and access, the fellowship transitioned to an online platform. The pandemic has further consolidated the need for remote capacity building for adolescents in research. The online fellowship affords young researchers the opportunity to be trained and mentored in various aspects of adolescent clinical research. Fellows also have access to the Adolescents in Research Toolkit, which is an online research for adolescent research stakeholders, providing resources on research, design, preparation, implementation, and dissemination. Some of the challenges that the team has had to deal with included juggling a variety of platforms such as Zoom, Microsoft Teams, WhatsApp, etc. during ongoing power cuts that often also affected internet connectivity. We had to ensure that teams were in different areas of the cities to ensure that they weren't all affected by power cuts at the same time. COVID-19 restrictions have also added to the challenges as all staff had to work remotely from March 2020 onwards. There's also been a significant increase in competing online interests and since all the lockdowns started. We've had to adapt fieldwork experiences to online platforms, and this has required innovative changes to the original program. An online course that mirrors elements of face-to-face experiences was required to ensure fellows can still benefit from knowledge of field workers, but this has been done through video recorded site visits and virtual experiences. Some of the benefits, we've managed to increase capacity to accommodate a larger number of students from more diverse backgrounds because there are fewer access barriers. Fellows no longer need to have visas, which are often difficult to obtain. There's no longer a need for local and international travel, which can often be difficult in the African context, and there's also no need for accommodation costs. Lectures and presentations can be pre-recorded, which allows flexibility and the creation of an online reference library that can be accessed at any time. Shift to online platforms has posed a host of different challenges. However, eliminating the need for physical travel creates the potential to expand opportunities and build capacity through a faster and potentially more efficient virtual world. This is especially important in the African context. We are in the implementation phase of the fellowship and thus far have managed to be flexible and adaptive in response to the many challenges this year has posed. We'd like to say a very quick thank you to our funders and partner organizations.
Well, welcome back, everyone. I thank you, Harley, and I think you will agree that we've had a broad spectrum of involvement of adolescents, all the way from them actually conducting the research, connecting with them better through telemedicine and other varieties, and then finally upskilling both junior potential researchers and other folk to more ethically, more constructively involve adolescents in research. So I'm just going to say, talking about all those technical difficulties, Harley, poor Zoe is struggling exactly with that at this moment, and I know she's trying to find a provider in Zambia at the moment that's going to support her participation. But in the meantime, we will go on as we have done in this virtual space. Nothing has daunted us so far. And without further ado, I'm going to ask a few questions. Lazarus, if you'll also be watching the chat section to keep an eye on questions. But the first question, Chelsea, comes to you from Monica. She's been fantastic. I've seen her questions throughout the month. Well done for participating so well, Monica. Chelsea, the question to you is really that how you actually did the coding. What was your methodology and how did that go?
Thank you, Monica, for the great question. So we actually started out by refreshing some of the thematic analysis skills that were taught in the training stage. And we used a really interesting candy sorting exercise. It was from the YPAR Hub at the University of California at Berkeley. They have lots of great open source lesson plans that I suggest everyone in this panel and the participants look at. So we distributed a bag of candies, and we had an instruction to sort of sort and group the objects in the way that the YIs, youth investigators, wanted to sort them. And then we asked them to explain how they grouped the candy and why, how many groups they made, and what that information told us about the group. So it was a lot of fun, and it was also a snack. So then we reminded them after that of the exercise of our guiding research questions that were formulated at an earlier stage. And then they spent time back in the data, reviewing transcripts, refamiliarizing themselves with the data, noting excerpts in a template we gave them that were particularly interesting and that related to the research questions. And then to your point, Monica, instead of a mind map, we used a tree. So we had a tree that had the research questions on it and the branches and leaves, and eventually the leaves became our codes. So that was the visual we used to map the data to. We then asked them, what kind of responses were coming up in your focus group discussions and your transcripts. And we started noting those down, and we tried to group the responses next to those that were the most similar. And then we started to create claims from the data in a collaborative discussion. So what can we state? What do we know is true based on this data set? And then they also started writing notable excerpts from their transcripts on Post-it notes, and eventually put those Post-it notes next to the codes, which were leaves on the tree. So we had a very colorful tree. I had a photo in my slides. So I hope that helps illuminate the process. And it was a really interactive and fun one.
Thanks, Chelsea. And maybe I'll just go a little further on that one and ask you, what was the, I think a lot of people don't go down this road because it feels like it's going to be very hard. And, so what would you say was the low light? What was the hardest thing? And what was the sort of best highlight in terms of this youth participatory research?
Yeah, great question. I think probably the difficulty that a lot of us could anticipate is maybe some of the more abstract processes in research, like creating codes or kind of groups. And so in that case, we always tried to sort of have a backup framework or tool or response in place that the research assistants or the senior researchers had created, in case there was a lull in the conversation or a little bit more guidance was needed, just to have that kind of, coding framework at hand, or at least some probing questions that could help, re-stimulate the conversation. So that was difficult at times. And I think that's why when there's a youth-led a youth-led research process happening, that there is support from adults in the room, and that it is mainly passive, but that if help is needed, that you can come and support versus intervene. So I think that did happen a few times in focus group discussions and in the coding process, that support was needed, but it was still really collaborative, and we really still thought about how we were approaching the group and that idea of power sharing that was mentioned in my presentation. I think the highlight was really towards the end, when the youth investigators created sort of dissemination briefs. And they really kind of broke down into brief nuggets what their findings were and for what audience they wanted to share that information with. And one of the youth investigators, a teenage girl from Mitchell's Plains, I remember said, beyond the principals and teachers and peers at her school, she wanted to disseminate her findings to the president, Cyril Ramaphosa. So it was a real highlight for all of us, and the information that they shared in their briefs were exciting, and we do hope that those will be part of the dissemination process soon.
Great. Lazarus, you have a question.
Yes, I do. I am more of a male advocate. So when I was going through this, and I was like, it's great. And if you look at data compared to men, young adolescent boys compared to the adolescent girls, data are there for adolescent girls, but data are lagging behind for the opposite sex. So are you planning to do the same thing for the male as well? And because we don't believe that the future is only female, and we don't want to have a lost generation of males. Yeah, something like that.
Yes, Lazarus. In fact, you're reminding me that even in the youth-led focus group discussions, this came up as a suggestion. The girls themselves said, in a future program for girls, there need to be boys. There needs to be a parallel program to provide health services for boys, designed the way boys need them, and they need different things in their programs than girls do. I think certainly at Grassroots Soccer, and I can probably speak for many of my colleagues on this panel, that we're all very interested in supporting and providing an active role for boys in research as well. We actively incorporate this kind of methodology into all of our grant proposals now, many of which do include boys. So we don't yet have that funding secured, but it's absolutely our aspiration and intention to do the same. Thanks for the question.
I'm going to direct a question to Abigail now, just in terms of the role of mentorship. I mean, I think we Harley alluded to it, that our e-fellowship program is really based on mentoring these young researchers. But even in programming, when you put these young people into that space, I think it's an important message that we don't leave them kind of, and I know Grassroots Soccer model is based on mentorship. So do you want to talk a little bit about the role of mentorship and how important it is to provide that support?
I think the role of mentorship is so important. I'm so glad that all of the studies highlighted that there's an accompaniment of these young researchers, not just in formulating the methodology, but really in conceptualizing how we're going to use this, how we're going to use this data, and who audience are. And for mentorship, it is that accompaniment process. It is from the design going right through to application of findings in different spaces, providing not just the space for engagement, but often providing the tools and different levels of expertise, connecting young people to colleagues, to peers, academia. How do we strengthen our structures? It's a long process, accompaniment of this movement of young researchers, this movement of young activists is a long-term process, and we need to treat it as such. It's not once off. Research is always with purpose, and we need to accompany that purpose. Yeah. One of the things PV specifically does, and we do this within our regional programs, especially around the community-led monitoring processes around specific health facilities, is we also then accompany the health facility to see processes more accountable. Are we talking to the needs here? It is looking at all of these various dimensions. Is this evidence leading to policy change? Is this evidence leading to reform? How do the youth engage in different platforms, connecting them with decisions to also then track the deliverables of whatever data they have surfaced through their various interventions. So this mentorship is such an important thing. It's something that we do not consider within our proposals, within our budget, and it does require a lot of resources and time.
For sure. So I'm going to ask Chelsea if she wants to comment on the mentorship piece, but also to pose the question of, I see an interesting comment there from Judy in the Q&A. What about closing the whole loop and actually involving these young people in manuscript writing? And we've certainly been talking about that. So I don't know if you want to sort of comment about that, Chelsea.
Absolutely. Thank you for the question about co-authorship. It's something we're discussing now. You know, I think there's one layer of our study, which is that it was the sub-study was conducted completely by adolescents. But then there's another layer of the study that, of course, was, you know, a large-scale survey, and there's a lot of quantitative data that was collected and analyzed by adults. And we're now thinking about how to engage those same youth investigators in the kind of interpretation and unpacking of our quantitative findings, and really, you know, the idea to include them as full co-authors in that authorship process, which is new territory for us, but we're excited about the opportunity. Again, I think this theme of mentorship, like Abigail and Linda said, is I mean, it's really foundational to grassroots soccer. But I would underline what Abigail said about, you know, really ensuring you've thought through the holistic funding and approach needed for the entire phase of the research or programmatic process. And that includes, I think, as early as developing your proposal. Oftentimes it's one or two staff sitting together typing a proposal, but really if you were to engage a reference group or advisory group at that stage, you could really, I think, do even more. And then through to dissemination, as I said, I think absolutely crucial.
And I want to absolutely welcome Zoe back, who back in the panel. Zoe, we showed your little snippet about your colleague, junior doctor researcher. Do you want to tell us a little bit about him, and what, you know, led to you making that video?
So Penyas is a junior doctor, like you said, and he's been doing research way before even graduating, I think starting 5th year. So he really wants young people to be able to participate in research like he's been able to you know, participate, just like I also have been able to participate in research, because he knows that once young people are able to do research or are empowered to do research, they can then inform policies or interventions for young people.
Great, and it makes me think of a question for Harley. Harley, of these young people wanting to do this research, what are some of their hardest, you know, what are the biggest challenges for them, do you think, that you've encountered?
Well, in South Africa, you know, internet connectivity, for example, I'm just thinking about now in terms of we are very restricted in accessing each other. So internet connectivity is a huge challenge in South Africa. Data is very expensive. People often share their phones in their homes. You know, it's not one person per phone. So privacy and confidentiality is difficult. And there's also a lot of stigma associated with taking part in research, depending on what that research is. So that ties in with the confidentiality aspect of it. And people often live in shared spaces. So it can be very challenging, and it can be very challenging just to reach adolescents, especially those that are very vulnerable. The ones that are at highest risk are often those that are not in school, they're not in training. So how do you reach those people? You know, it's very challenging, and I suppose the starting point is always work with your community, consult your community advisory boards, especially the youth advisory boards, get them involved, speak to people, let them know what you're doing, and they can spread the word. That's always going to be the starting point.
Lazarus or Zoe, have you got any more questions for our panel? I'm starting to see them come in.
Yeah, please. Okay, Zoe, can go ahead.
Okay, so I have a question for Chelsea. And the question is, how did you manage to get rid of the fear of teaching sexuality or just having sexuality knowledge? Because in Zambia, we have a situation where teachers went to complain about CSE, and everybody wanted to halt CSE or suspend it, notwithstanding the fact that during the COVID period, we have seen teenage pregnancies rise. Data has been showing us so many things. So how did you manage to get rid of this fear in society?
Wow, it's a really big, profound question, I think, for this whole panel to really reckon with. I think that we were fortunate in that this study was complementing really a government directive, and Linda Gale could complement this response called Keeping Girls in School. And this was I guess it was a complement to the CSE, existing CSE in school, which is called Life Orientation here in South Africa, that was trying to cover a few more sexuality topics and really focus more on the topics that matter most to girls. And the hypothesis is that being part of this program would help them stay in school. And I think that what we found through reviewing the content was that there were still some really important gaps. And I mentioned one early in my presentation, which is addressing the issue of gender roles and power relations in intimate relationships, in family relationships, in friendships. So I think we were fortunate that that was already a directive from the government. And so there was support within most schools and most teacher and principal relationships. However, like I pointed out in the why I collected data, many girls spoke openly and with a great amount of discomfort about the obvious fear that teachers still had in approaching the subject, as you said, Zoe, and that in fact, many of them were concealing, certain topics or not even covering certain topics. And that was obvious to the girls. So I think that while that fear and that stigma has not gone away completely, we were fortunate to have the support of the government in this existing program that we were complementing. I don't know if anyone would like to complement that.
Yeah, I think it's always hard to cover these taboo subjects. I know it was raised earlier, and what you're struggling with, Abigail, in Namibia is, I think every single country represented on this workshop is going to say we're all struggling with the same thing. And my own take on this is that more and more we need a harm reduction approach to this. Even with the sort of the concept that young people, it is in their transitional state that they are going to be experimenting in sex is in their program. It's part of where they have to go in terms of their developmental programming. And so if we can rather than moralizing or think of it as a harm reduction, we don't want harm to come to these young people. The way to do that is to make sure they have enough information, they have the tools to protect themselves, etc. I wonder if we can try and move it away from the moralistic argument, which is often a very difficult one to combat. Zoe, Lazarus, what about more questions from your side? I see Clarence is back. So I think you had a question way back, Lazarus, for Clarence.
Yeah, there's a question from Linda. Where's that question? So.
Sorry, the chat is growing. I can help out there, Lazarus. It was somebody asking about the cost of SMSs, Clarence. That always comes up in the question. Did you get it prorated? What were the technical difficulties of having an SMS approach to reaching these young people?
Yes, in terms of the cost, cost is always associated with projects. There's no way you can do a project without involving in cost. That's part of the project. If you want to get a good study, at times we don't put cost as a major thing. But in terms of the cost, it was not all that too expensive because we actually went for negotiated with the company that we're working with, and they actually have a reduced cost. So when you are selling, SMS in bulk, the cost is always reduced. We're having, I think, we're sending 2,800 per session that we're sending for each batch of SMSs to approximately, 2,400 learners. So the cost, not to the learner per se, but to the parents' phones. So it was actually, not too that expensive. But when you want to achieve in terms of research at times, that cost was not much, but we thought that it was beneficial during this process of COVID, where we can help to diffuse information, fake information, get information from the parents and the learners, so they can get information from us, which were more authentic than getting information from unreliable sources, which may lead to confusion and more confusion. So we thought that if we can be actually informing them, guiding them, getting information to them, directing them to various services, that would have been of better, better use to us than to say cost. It was not all that expensive, but I think it was useful.
Thank you.
Linda, we have do you want to start, Lazarus?
Oh, okay. There's a question from Aaron. I don't know if I should direct this question to Abigail. How do you ensure there is an active system that ensure that young people are engaged in research designs? And do the young people people's effort get appreciated? If yes, then how? Yeah. And what does it take to design a youth-led research project? And what is the process like? So that is the question.
There were 4 questions.
Yeah, a lot of them.
So what does it mean to consistently and consciously include youth in research is to actually just do that. It is to ensure that there is youth representation in our processes, that we do not do research on behalf of groups, that we have young groups like yourself, other networks of young people. I was thinking of AfriAN, which is a regional network of youth-led participation in SRH&R, to be not just informant, be active leadership on research design, implementation, data collection, information, dissemination information. When we take it a step, then how do we integrate these lessons into thematic considerations, ensuring that we have those groups we are claiming to work for, are saying that we want to work, we want to create this enabling environment for young people to actually inform what the programmatic design looks like, and ensure that there's consistent voice within those processes. One of the things that we've been doing, especially with our adolescent girls and young women programs in the North, and I think it is within the sites in the Northern areas, they're designing their own research package, but also designing their own implementation package, who they need to connect with, what are the topics that they need to address based on the vulnerabilities, based on their needs within village spaces. So I'm talking very rural spaces, because we often have programmatic designs, research designs that taps into the urban, peri-urban, because it's easily accessible design, and we don't reach down to the actual grassroots and the most vulnerable and marginalized of groups. So it's ensuring that we are equipped with the know-how, that we share the data, that we break it down in chunks that we can use, that the groups can engage in and constantly engage at that platform.
Okay, thank you, Abigail. Clarence, do you want to respond?
I didn't get the question correctly.
Okay. Lazarus, do you want to repeat the question?
Well, I wonder if we've sort of covered that. I'm wondering if we pick up on Irene's question, which is what advice would you give to young people in regards to engaging in research processes? And maybe I'll pose that to Chelsea in the first instance, and then ask Harley to comment also on when these young people have come for their e-fellowship, they're wanting to engage in research. What are some of the hardest things that they are trying to overcome? What are some of their main challenges? Maybe start with some advice, Chelsea.
Sure.
I think probably the first thing is to stay curious. I'm sure it can feel like a very intimidating process to be part of something that you've heard about, you've read about, you may have learned about in school, but suddenly you're an active role taker and conducting a really important investigation into issues that matter to you and your peers and family members. So to stay curious, to ask lots of questions. And then the other thing I would say is ask for what you need. I think, this is a relatively new frontier, this, sort of youth-led, but sort of adult youth power sharing arrangement. And adults may think they've thought through all the necessary stages and resources and support and mentorship needed, but we may be forgetting some really important things. And I think the third thing is really to have those adolescents that are active role takers to continue to engage with their peers that maybe aren't involved in the research process or aren't involved in the research project or the program, to really engage with peers in their community to ensure their voices are channeled and amplified and heard.
Thanks. Harley?
Yeah, to respond to your question about what some of the fellows find challenging, the mentorship is really such a key component, and a lot of our fellows bring this up time and time again. It's how important it is to be mentored, because the mentor is not just someone that guides you through various processes. It's someone that facilitates access to networks, facilitates access to opportunities. A lot of the fellows are just not even aware of which opportunities are out there, and this ties into the funding. There's a desperate need for accessing funding, and a lot of fellows just struggle with how do you access the funding, where do you go to find the funding, how do you write a proposal, so this is why the mentorship component is such a key. And then again, of course, the traditional sort of academic outputs, manuscript writing abstracts, submitting to conferences, submitting for publication. It's really a huge challenge because a lot of people you can do the research, you can get the results, but then what's the next stage after that, and where do you begin? And that's why the mentorship is such a key to helping the fellows take that next step.
Yeah, thanks.
Thank
Challenging for older researchers, I just want to put that out there. But sorry, over to you, Zoe.
Okay, I would like to ask, I don't know who will take this, but what are the things that senior researchers overcome when it comes to opening up and working with young researchers? Maybe Harley, you could start.
Yeah, I think for researchers that have been in the field for a while, it's always good to be exposed to kind of younger generations, and that synergy. It affects the way they think about their own research and their own design. And it's about including younger researchers in the design from the very design phase of it all through to the publication phase. And that's really the key to it, is the youth expose them to new ideas or things that they haven't even thought about, because as you know, the world's shifting so fast. There's like multiple platforms coming out every day, every week, and that's really the importance of engaging with the youth and younger researchers.
Thank you, Harley. Clarence, I have a question for you. Were young people involved in the design of the GAP project?
Yes, actually, the project was actually for the youth, it was for learners in high school. So they were the one who we started the project from inception by doing formative assessment with them. But the only thing is that when we now move to the stage of collecting funds for the learners, because of the ethical issues, we were not allowed. So we collect funds, but from the parents. So to reach the parent, the learners will pass through the parents. So, but the learners were the one who were engaged in the project from the beginning, because an after school program, we were giving to learners in 26 schools in South Africa. 13 intervention, 13 control schools. So actually, the learners were the one that were involved in designing the program from the beginning till the end. Yeah. Hello.
Lazarus, I see. Thanks, Clarence. That was spot on. I see a question there from Irene, which I think you could perhaps pose to Abigail or anybody on the panel.
Yes, there was a question that was not responded to from Irene. No, yeah. It was directing to Chelsea. I guess during any research study, especially one that is youth-led, what are the key variables in the study, and are the chances of manipulation of data during data analysis?
Thank you, Irene. So yeah, so in our youth-led study, it was exclusively qualitative. We are looking at other examples of youth-led quantitative research, and I would encourage anyone that's considering that is to use the same variables you would in adult-led research. I think we did not come across any issues with manipulation. I think it's hard to say that there aren't some clear limitations that should be explored and understood better when it comes to social desirability bias and selection bias and that sort of a thing. We did not have any, as far as we can tell, manipulation of data, and we did not have quantitative data. But I think it would be great to hear from other members of the panel about youth-led quantitative research, because our study was qual.
Leading from that, Chelsea, just before, I just want to capture, because we are getting near to the end of our session here, is the ethical dilemma of, was it hard to get ethics boards to agree that we could let young people collect the data? And how do we encourage ethics boards to agree to this?
Is that question to me, Linda Gill? Yes.
Sorry.
It's okay. We had a few rounds of, I remember, discussions and iterations to our, we had some amendments, and then we also tried to create kind of a group for the youth investigators, which was harder to get through ethics. But we were successful eventually in all of the things we requested. I think it just did take a little bit more discussion, clarification, and it is, like I said, a relatively new frontier. So it was not impossible, but it did take a few rounds of discussion and commentary to resolve.
So we are in the last few minutes. I wondered if we could go around the whole panel, including our wonderful young co-chairs, to just ask, what do you think is the most important message that you've heard from the session this afternoon in terms of nothing about us for us? So I'm going to start in the top corner and work around, and as I say, include the co-chairs, because I think your impressions and your voices really matter here. Holly, starting with you, what do you think?
I think for researchers, it's in the design phases to make sure that you're including adolescents from that very early phase. And that has to be part of your research design that you then, and part of your proposals when you're looking for funding, is you say, we want to include the adolescents from start to end. And I think the more researchers that do that, becomes more of a trend, and becomes easier.
Great, thanks. Abigail?
To stay inquisitive and curious. I think Chelsea mentioned this and made this important point, and that we need to treat every single opportunity as a learning event. How do we start to people frown upon? How do we redesign these processes? Who do we need to talk to? If we're not constantly in that, I want to learn more, it's kind of difficult to incorporate some of the lessons that are staring at us.
Thank you. Clarence, what are your thoughts? Have we lost Clarence momentarily? We'll come back to him. Chelsea, your thoughts?
Thanks, Linda Gill. You mentioned needing to have a clear investment case, and I think maybe the call to listeners and panel members is really to document, not just in sort of academic journals what your findings are, but what your process was. How did the implementation work? What were the obstacles and barriers, and how did you overcome them? I think that's how practice advances, and that's how the research advances, and that's how we can form an investment case for this important area of methodology.
Great. Lazarus, what were your take-home messages this afternoon?
Okay, I'm unmuted. So my takeaway message is you cannot research about us without us. Meaning you cannot you cannot want to research on adolescent without seeing one. And especially like to inform policy, I was never interested in research. Now I am. So, but to inform policy programming officers, we have to do our own research, and that is actually a key for us as young people. And from now on, I'll take it serious.
Thank you. Zoe, you as a young budding clinical person, what is your final take home?
So my take home message is that young people with the right mentorship, young people with the right support can do research, and research that can be considered for policy, because we have seen through this workshop how 2 young people had oral abstracts. I think for me, that's powerful. If 18-year-olds can have an oral abstract, it means that young people are able, if only we make the environment friendly. If, for example, if ethics is the problem, we talk to ethics boards and see how, you know, young people can be empowered to be trusted more with data, to be trusted more with research work, because I think this workshop, all in all, is a testimony that that can be achieved. So I think to everybody that is watching this session, it's to urge you that involve young people in your work, involve young people in research. And if young people are not involved in the process, then you're not going to get anything meaningful out of it. From the Zambian Youth Hub, I think we had a session where with the assistant director from the Ministry of Health, who thought a program was working. And yet young people had a different view. So if young people are engaged, we will know what works and what doesn't work. Thank you.
Thank you. And I'm going to say my take home, and I'm going to say this loud and clear as an old person on this panel, that if there is a myth and a prejudice that young people cannot be trusted with data, that is wrong, and it should be, called out. There is no evidence that young people are any less authentic than older people. And in fact, I would argue that they are far less likely to put up with nonsense and something that is untrue than their adult counterparts. So on the contrary, I fully support that young people should be allowed to handle data and should be trusted with our data, as long as they are explained to why the data is important and what its final outcome is. So on that note, I will thank an amazing panel for their terrific insights and their all the information we've heard. I want to thank my brilliant co-chairs, all their help in putting this terrific session together. In fact, I must be honest, I came along for the ride. Zoe and Lazarus did it all, so thank you for that. And thank you to everyone who contributed again this afternoon. There are a few housekeeping things we need to do. So I'm going to remind you about our sponsors. We've had some terrific sponsors for the e-virology month on HIV and adolescence, and here you see them. Terrific help through many years, and we hope they'll continue to sponsor this very worthwhile workshop. Please write and tell us how much you've enjoyed it, because we use that to make sure they keep sponsoring us. So please continue to show your support. And then I'm going to remind you that session 8 is on its way. Here you see it. And I can highly recommend. This is going to be looking at things like mHealth, new innovation, new creativity, and how this can be used for young people. And again, we'll have some terrific abstracts there again. This afternoon, come back for the posters. It will be both session 7 and session 8 that will be showing the posters this afternoon. So please come back and enjoy those posters. Those are your peers and people who've worked hard to put research together for you to enjoy. So that's happening this afternoon. Otherwise, have a great afternoon, evening. And again, thanks to everyone for their participation. Thank you to Karen, Rika, and everybody back in the studio, as they say. Take care, everyone.